this evening. I want to thank you all for joining us. My name is Jason Lake. I'm the Vice President of Sales for Lumiere Medical. Today we're going to discuss the integration of RF, specifically TriPollar RF, into a weight loss practice. What are the benefits, who is the ideal candidate, and how can it be used to grow your practice? But more importantly, increase patient satisfaction and success. Before we turn it over to Dr. Crystal Broussard, I'd like to spend a few minutes explaining the TriPollar and why it's an evolution in RF technology. I also want to remind you to ask questions. We'll be taking all questions in the chat box found on the right-hand side of your screen, and we will have an open forum at the end of our presentation. So what is TriPollar technology? TriPollar is the most advanced radio frequency technology available now. It's recently FDA cleared back in November of last year for the non-invasive treatment of mild to moderate facial wrinkles. It's a third-generation device. Some of you that know radio frequency know that there was monopolar years and years ago. Then it went to bipolar, and finally we've landed on TriPollar technology. It's clinically proven and used successfully by physicians around the world with 3,500 machines installed worldwide. It's recently become available in the U.S. via a device called the Apollo. The Apollo regenerates collagen, tightens and tones the skin, improves the appearance of cellulite, and reduces body circumference. It's used both on the body and the face. So how does the technology work? It works by simultaneously heating deep and superficial skin layers, stimulates natural skin renewal process, tightens existing collagen fibers, and augments new collagen generation. It also causes fat cells to shrink, improves cellulite appearance, and reduces circumference in the abdomen, arms, flanks, and thighs. It's a patented proprietary TriPollar technology, which means that the RF energy is flowing between 3 to 6 electrodes. Any one time, there are 2 negatives coming back to 1 positive, as you see in the top right hand of your screen. It's got a higher density power in the dermis and hypodermis for volumetric heating. The penetration depth is controlled and limited to the treatment area only. The TriPollar RF is proven clinically to simultaneously and homogeneously heat both superficial and deep layers, resulting in collagen remodeling and fat reduction. I'd like to welcome on Dr. Broussard now, who is a board-certified family medicine physician. She's an active member of the American Society of Bariatric Physicians and medical director of Athena Wellness Center in Woodlands, Texas. She also teaches other medical professionals on how to treat obesity. So I'll turn it over to you, Dr. Broussard.
Thank you so much. So I'm really excited to be here just to kind of give you some information about how you would incorporate Apollo into a medical practice that also does weight management, because that's what I do. I actually purchased the Apollo because I wanted to add non-invasive body contouring to my medical practice. As patients were losing weight, they started asking me, what can we do about this wrinkle? What can we do about this loose skin? And so it was a really natural way to add to my practice. And then one of the most important things when I started evaluating the different machines available, because there's all different types of technology and different machines available with each part of the technology, was what works. That was the most important thing for me. I don't have an aesthetic practice completely separate. These are my weight management patients, and that's why I brought the aesthetics in. So it was very important that the machine works because I have a continuing relationship with these patients. I had to bring in technology that worked for the patients because they trust me. This just goes over different articles. I've reviewed all of them about the things that TriPollar can do as far as acne and the aesthetics and targeting specific fat cell reduction. I like the fact that they've done studies on the histopathology, that they've actually looked at tissue samples to determine the depth of treatment. So please take your time going through them. I'm not going to go through all the individual studies, but it's really important to learn that it is a peer-reviewed technology, and it has been published in articles since 2009. So the other thing I was looking for, I needed to make sure that my patients would get results. And what I loved about Apollo is that you get immediate results. They walk out after the first treatment seeing the results, and that they also get long-term results. The results get better and better with each treatment. It's very pleasant. It does not hurt at all. It feels like they're getting a massage. No downtime, no sensitivity. It's simple. It's quick. They walk in, they walk out 30 minutes to 50 minutes later with tightened skin. non-invasive, there's no pre-treatment at all, and absolutely no recovery time. It's very safe. That was another thing that was really important to me because I did not want to do anything that was invasive. There's no burning, no scarring, no heating or cooling. It's a very simple technology to use. You can start using it after 5 minutes on a patient. 5 minutes to learn how to do it, and you can effectively do it very safely. It's also very safe for all skin colors. So it comes with 3 different applicators. There's a large one that you use for the abdomen and for the thighs, a medium size that you use for a lot of the face, and then a small one, that number 1, that you use for the delicate areas such as around the eyes and around the mouth. They also have a LumaCam, which is absolutely fabulous, that comes with the Apollo system now. And it actually gives you immediate feedback that you are at the appropriate temperature to do that collagen rebuilding, which is the purpose of the technology. So it tells you that you're at your desired temperature. So it allows you, the technician, as the physician or your esthetician, to know that you're on temperature. And then it's also just a reassurance to the patient when they see that it's actually working at that time. So the Apollo system is a dermatologic treatment system. It's for non-invasive body circumference reduction. It treats cellulite, it treats wrinkles, and it does do skin tightening. And I use this myself in my practice, skin tightening on the abdomen specifically, as well as the neck and the face after weight loss or during the weight loss. It does change the appearance of cellulite. And that includes both the hard type of cellulite and the soft type of cellulite, because my ladies have different types of cellulite. It helps with sagging of the skin, abdomen, thighs, knees, arms, hands, buttocks. I've used them in all of those areas. It also helps with post-pregnancy reduction in the skin and back to skin tightening, and with weight loss. The results that you see treating a postpartum woman just after delivery are absolutely amazing. They walk in and walk out like 2 different women, and it also really affects the way that they're feeling about themselves. They leave feeling like they're getting their pre-pregnancy body back after 1 visit. It helps with the bulges that you get in your stomach and thighs, the love handles. It also helps with texture and appearance. Now, I am a weight management doctor, so I see a lot of patients that come in and out after having liposuction, and they regain weight, and then they're lumpy and bumpy. And I've actually had great success in using the Apollo machine to actually help even out the texture. So again, information about the studies for circumference reduction. And again, I'm not going to go through all of this. Please do read up on it, though. It has been shown to decrease circumference, which is great. I get even better results on what happens with the appearance. My patients are more excited about the appearance than they are the specific inches, but they do see changes in inches as well. And same thing here, another one looking at localized fat and cellulite reduction and how the collagen is actually remodeled. So I find the ideal candidate is most of my weight loss patients. They can either get skin tightening during or after weight loss. I have some patients who lose as much as 200 pounds with me. And I found that if I do Apollo treatments during the course of their weight loss, the amount of excess skin they have at the end is completely different. So I feel like I'm helping to prevent other more invasive cosmetic procedures being needed if I can do Apollo during the course of their weight loss. It also can be used to target localized fat, like arms and the left handles and then the thighs. I have a lot of patients that get to the end point of their weight loss and they still have some problem areas, so it works great for that. It also helps with just the motivation when you're getting started with a weight loss program. You see results faster, so you are more inclined to follow the diet recommendations and do your exercise when you're seeing results, and you get better and better results as you do those things. And it also non-invasively treats cellulite and stretch marks. There is not a lot of technology out on the market that does this. Does it well, does it non-invasively. And I found that Apollo has done a great job for my patients with both cellulite and stretch marks. So we usually recommend anywhere from actually 4 to 8 weekly treatments. For me, it depends on the treatment area. I find that the body, the cellulite needs closer to the 6 to 8 treatments. The face, the skin tightening, closer to 4 to 6. It does reduce the circumference and treats the cellulite. Again, what is so important about this machine is you get the results after the first visit. And then the maintenance as far as treatments, you do need to maintain treatments. I tell my patients, you will continue the aging process after you are treated. And so we usually set up a maintenance program where they come in for 1 to 2 treatments every few months just to help keep the results that they've obtained. So this is an actual patient of mine. She is 44 years old, came in to talk about the stretch marks. Her stretch marks she's had since she was 15 years old. When she hit puberty, she gained a lot of weight, and then she had these unsightly stretch marks with very, very hard texture to them. It's something that prevented her from wearing a bathing suit on a regular basis because she was too embarrassed about them. These are very old stretch marks. I told her from the beginning I wasn't sure if Apollo would treat her stretch marks or not. This is actually after 8 treatments. We did the treatments a week apart. Her results were phenomenal. She wrote me a thank you note that she went to the beach, wore a bathing suit for the first time, and as long as she could remember. The texture of the stretch marks were completely different. You could barely even feel them running your hand on her skin, where before there were huge creases in between every stretch mark. So these results were by far better than I ever expected them to be. So I was really excited for her, and she was thrilled with the results. This is a patient who was a weight loss patient of mine. He lost 21 pounds with me, doing all the things he was supposed to, watching his nutrition and exercising regularly. Actually lost 9% body fat, and he just had a little bit of the love handle issues that he wanted to get rid of. So what we did was Apollo for him. I did 8 treatments a week apart, and it significantly reduced his love handles. And so he felt better in his bathing suit and felt better going without a shirt and felt like he looked like he had put all the effort in that he had spent the last 3 months with me doing. And this is a patient that came in specifically for cellulite and then also just texture of her legs. She did 8 treatments with me a week apart. She actually lost 2 inches off her thigh, but then also got these great results as far as the change in texture, and she was absolutely thrilled with the results. She had tried multiple different types of procedures for cellulite, was very leery about trying anything else. But she had a really great result, and she's thrilled with it. So I think now we're going to take any questions. So if y'all have questions, I think Jason's going to chat with you about those.
Sure. We have a question about the contraindications using the Apollo.
The main contraindication is any type of active autoimmune disorder. So if they have active lupus, if they have active rheumatoid arthritis, something that's flaring up, there has been some question as far as even like active Hep C. I've actually treated patients with Hep C as long as their viral load was not high. So that's going to be the main issue. Anything that's active, if you wouldn't be recommending typical a weight loss program to them or any type of exercise program, that's a patient that I would hold off on. But mainly it's autoimmune disorders.
Okay, we have another one here. What's the ideal patient BMI for the TriPollar treatment, and can larger or obese patients benefit from the Apollo?
Sure. Any BMI. I have patients that are morbidly obese that I've done this on, and they've gotten great results because, again, they saw those inch changes faster. They saw the skin tightening, motivated them to keep with my weight loss program. I have patients with a BMI that come in of 19. They are completely normal BMI. The percent body fat is exactly where it needs to be, but they have problem areas. They have the love handle issue. They have the cellulite. So those are great candidates too. So anywhere along the spectrum.
Okay. And finally here, if anybody has any additional questions, please put them into the chat box. But the final question here is, what if a patient has a few pounds to lose? Is TriPollar a good alternative for someone that only has a few pockets of localized fat, say, for example, the tummy or arms?
Yeah, I think so. Again, we've done the love handles several times, especially on men. I've had unbelievable results for women for the arms, especially with the summer women that had lost a lot of weight and they had issues as far as having some fat pockets left and they wanted to tighten up, and that's been a really great thing too. I've had some strange fat pads that are on patients' knees and ankles, and they've responded great to Apollo, and it was kind of one of those, I didn't know if it was going to respond or not, but all those small pockets of fat tend to do really well with it.
Okay, we did get another question here. How does non-invasive RF treat stretch marks?
Okay, so again, it's heating up the collagen layer. So it's heating up the layer of the skin where the collagen actually tightens and then rebuilds. So it's that rebuilding of collagen, so kind of the anti-aging part of it that actually helps to fill in the stretch marks.
Okay, if there are no other questions, thank you, Dr. Broussard.
You're welcome. Thanks for having me.
Okay, we'll take it. We have a couple more things to do here, folks, and then we'll finish up. Just kind of conclude, the Apollo gives you immediate visible results with long-term durable results. The treatment itself feels like like a hot stone massage, it's referred to, with no pain even on sensitive or loose skin. It's non-invasive, simple, quick walk-in, walk-out treatment, no treatment anesthesia or recovery time. It's safe with no chance of burns or scarring. There's no heating and cooling cycles. And it's effective on all skin colors. So it's basically colorblind, so we can treat patients year-round and all skin types. It's also easy to learn, easy to use, and safe. It can be delegated out to staff and used as passive income. It's advanced, straightforward interface, default presets on the screen for the various body parts, very short training time. It's very easy to use as well. There's no consumables with this. There's no number of shots you can have on the handpiece. There's no expensive gels to buy. Basically, once you own the Apollo, it's paid for. It's compact and mobile. It only weighs 42 pounds and has a very small footprint in the office, not taking up a lot of space. And it's competitively priced. It's a high-end device at a very reasonable price, again, with no consumables, no recurring costs, and a very quick ROI. If you have any more questions or would like to have a demo in the office, please contact us at sales@lumieremed.com or call us at 877-701-2699. I'll leave this slide up on the screen for a few minutes. But I appreciate everyone's time tonight, and please reach out to us if you have interest in the Apollo. Thanks, and have a good evening.